We're going to talk today about the role of lipids and the role that they play in cardiovascular disease. So Pat, when a patient goes to the hospital and gets a blood test drawn for lipids, he comes back with a bunch of numbers on there and words. Can you kind of go over the basics of what those numbers mean, what lipids are, what their normal function is, and how we measure them?
The total cholesterol is a combination of HDL, LDL, and triglycerides. And the HDL we consider the good cholesterol. Good cholesterol because we think of it as removing cholesterol from the body. LDL, the bad cholesterol, because it's in the blood and it accumulates in the vessel wall and clogs up the arteries. Triglycerides can clog up arteries also and cause other medical problems. What we want to do is find out what is your risk for a heart attack, stroke, for having to have bypass surgery, and we get all that, a lot of that information from the basic lipid profile.
What are the numbers that we're actually shooting for as a goal in different patient subgroups?
Right, yeah, that's a good question because sometimes the patients say, well, my number falls in the normal range.
Right.
And the normal range might be 80 to 120 for LDL. And for us, with someone who's had a cardiovascular event, bypass, stent, heart attack, an LDL of 100, 110 is very high. We want it way lower. LDL, we can't get too low. The lower the better. HDL, on the other hand, the higher the better. Yeah, so there's really no normal there. And finally, triglycerides are the most responsive to lifestyle changes. Right. We can see dramatic changes in triglyceride numbers. There again, lower the better. And the things can lower triglycerides are weight loss. Even 5 to 10 pounds of weight loss, we've seen lower triglycerides significantly. We look at the patient's risk for a cardiovascular event, and if they've already had an event, we'll get very aggressive with LDL lowering and ideal optimization. If someone's not had a cardiovascular event but is at risk for a cardiovascular event, then we try to use things to balance the therapies with the results that we can get with those therapies. And we use things to assess risk, family history, other risk factors. Sometimes we use coronary artery calcium scoring as a test to guide us. As if there's plaque in the arteries, then we think, well, we got some plaque there already. We better get the numbers.
And it is interesting that those numbers have changed over the years. I can remember when we started, the quote normal LDL cholesterol was like 160.
Yeah.
If your LDL was less than 160, you were good. Then it moved down to 130. Now it's 100. And now it's even down to 70 if you have underlying vascular disease. But as you said, when it comes to LDL, the lower the better, and there is no threshold for being too low that we know of.
The challenge we face in modern society is that we only need a very small amount of lipid. We can accumulate much more than we need, and when we get that in the bloodstream, it can accumulate in the blood vessels.
So that when we're born and are very young, our LDL cholesterols are actually quite low, right?
Correct, yes, and there are many societies where there are no heart disease where LDLs are very low.
Right. We'll move on then and talk about the role that lipids play in the development of atherosclerotic disease. Atherosclerotic disease means disease of the blood vessels where this lipid-rich plaque builds up in the walls of the blood vessel and over many years causes a gradual narrowing of the blood vessels. And this can result in reduction in blood flow. If it happens to the blood vessels to your legs, you can have symptoms such as leg pain or fatigue when walking. If it happens in the blood vessels to the brain, it can result in a stroke. And if it happens in the blood vessels to the heart, it can cause symptoms such as chest pain, shortness of breath, or acutely, if one of these cholesterol-laden plaques ruptures or breaks open, it can actually cause a heart attack. So the relationship between cholesterol and blood vessel disease has been known for a long time. But recently, over the past 20 to 30 years, there have been multiple trials that have shown that by lowering the cholesterol, particularly the bad cholesterol or LDL cholesterol, you can actually lower your risk for heart disease down the road.
We're fortunate to have an incredible staff in the lipid clinic, pharmacists, nursing, nutritionists, and the physicians. And so they're really good resources for patients to learn about what they can do to decrease their risk for a cardiovascular event.